Okay, the second topic about the sex hormone, female sex hormone, we have progesterone. This is a natural hormone. Then we have chemical synthetic hormone called progestins. So we are going to speak about this type of natural progesterone and synthetic progestin, chemical progestin. Okay, for the progesterone, we have, as we mentioned in the aerial here, we have natural progestin, and this produced in response to the luteinizing hormone. So the luteinizing hormone will stimulate release of progestin. In female, the progesterone will be produced from the corpus luteum during the second half of menstrual cycle. Also, we have during pregnancy, the progesterone will be produced from the placenta. So we have two main sources of progesterone secretion. During the menstrual cycle, we have corpus luteum will be responsible for secretion of progesterone. In female, during pregnancy, the placenta will be responsible for the secretion. In males, we have some progesterone, yes, coming like from the testis. We have some progesterone. Then we have another organs in both male and female responsible for the progesterone secretion, adrenal cortex. So you can have it in both sexes about adrenal cortex in male and female. Okay, what are the effects of progesterone in females? The progesterone plays important role in the reproduction, important to prepare the endomaterial for embryo implantation. So progesterone prepare the environment for the endometrium to receive the oval with a maybe embryo implantation, prepare the environment for embryo implantation. During the menstrual cycle, if you talk about pregnancy, so prepare the endometrium for embryo implantation. But what happened during the menstrual cycles? They said a high level of luteinizing hormone inhibit gonadotropin, high level in luteal phase inhibit gonadotropin production and prevent further ovulation during menstrual cycle. What that mean for us? So if you have high level of progesterone, if you have high level of progesterone, the result will be inhibit LH. So this is the situation here. When you have high level of progesterone, this will practice the inhibitory effect on LH, and for this reason, this may lead to the inhibit ovulation during the menstrual cycle, and we could use the progesterone as oral contraceptive. Again, we need to remind you with the main source of progesterone is coming from the cholesterol. So if you look on the website here, for example, only to maybe show the image from the website, you can see here the main source of progesterone coming from the cholesterol. Then we have pregnenolone, we have progesterone. So you can see here we have enzyme cytochrome B450, 3-beta hydroxysteroid dehydrogenase, and this will lead to the formation of progesterone. Okay, what is the role? What is the role of progestin or progesterone during pregnancy? Progesterone maintains endometrial for pregnancy. This is great. Number one, this is the first benefit. Maintain endometrial for pregnancy. Continue secretion of progesterone to maintain endometrial for pregnancy. Number one. Number two, progesterone decrease uterine contraction, and this we can call this one progesterone support pregnancy. So two things: maintain endometrial for the pregnancy, prepare the environment for the pregnancy, and reduce contraction and avoid or reduce risk of abortion. Okay, what happened here if, for example, if the conception does not take or occur during the menstrual cycles, the corpus luteum will stop secretion of progesterone, so the situation will be abrupt decline in the progesterone, and this will stimulate the onset of menstruation. So we have to approach, if we have pregnancy, the progesterone will continue reduces from the placenta to maintain endometrial pregnancy, reduce contraction. But if we don't have pregnancy, the corpus luteum will stop producing progesterone, and abrupt decline in the progesterone will maybe stimulate the onset of the menstruation. We have progesterone here for natural progesterone. We have some facts here about natural progestin. The natural progestin called progesterone. So the progesterone is like considered the most important progestin in a human, synthesized from the ovary mainly, and we have testes and adrenal cortex will produce in small amount. So this is the main source, ovary. Start synthesized from the cholesterol in the circulation. If the pregnant take place, the placenta will produce the major progesterone to maintain pregnancy and with a large amount of progesterone. Okay, so medication, now we have pharmacology, we have drugs, we have hydroxyprogesterone, we have medroxyprogesterone, migestrol. So medroxyprogesterone, migestrol. Then we have older progesterone, then we have newer progesterone. We need to compare between the two compounds. The older progestin has more androgenic effect. So we talk about some androgenic effect, that we talk about male effect, such as L-norgestrel, norethindrone. So here we talk about the older progestin coming with a more androgenic effect. This we have L-norgestrel, norethindrone. They developed a newer progestin with the less androgenic effect. We have the norgestimate and disogestrel. So we need to remember these synthetic progestin, medroxyprogesterone. Then we have L-norgestrel, norethindrone as older medication. Then we have newer medication, norgestimate and disogestrel. Effect of progesterone in general, they found the progesterone increased secretion of insulin in response to the glucose, increased secretion of aldosterone. This may explain the edema, for example, when you prescribe this medication. Increased body temperature, fever, and during the menses, for example, we have fever there, some elevated blood pressure. Increase the tenderness of the breast, and responsible for the development of secretory apparatus in the breast and prepare the breast for the lactation. Okay, important things here. The progesterone responsible for depressant effect, depress the brain, and induce hypnotic effect. Two things. This one maybe a little bit, need a little bit of explanation. Progesterone practice depressant and hypnotic effect on the brain. For this reason, I have to review article and bring a picture or image to show you the effect of progesterone on the brain. Okay, so as you can see here by clicking the mouse here, you can cholesterol is the main source of progesterone here. You can see here we have two maybe mediator involved. The main mediator involved in the regulation of the progesterone and other hormones. We have GABA. So you can see that GABA involved in the effect of progesterone. So now we understand the situation here for the medication. If you go to the slide, next slide. Okay, hypnotic effect, depressant and hypnotic effect on the brain. Here we start thinking about GABA. GABA A, and we know that GABA responsible for sleeping, and GABA responsible for anti-anxiety, depression, depress the brain. It's not a depression. Depressant effect on the brain induce hypnotic effect on the brain. So now we understand how progesterone induce hypnotic effect on the brain. Okay, so the clinical use of progesterone could be used, or progestins, any synthetic. For progestin, I will go back to remind you, we have medroxyprogesterone, we have norethindrone, we have norgestimate, drospirenone, disogestrel. Clinical use could be used for hormone contraceptive, hormone replacement therapy, dysfunctional uterine bleeding, treatment of dysmenorrhea. If you go back to the previous slide, you can find that estrogen cause bleeding. Estrogen cause uterine bleeding. So on the other side, progesterone use it to treat bleeding. So we have opposite action between estrogen. Estrogen cause uterine bleeding, and progesterone could be used for treatment of dysfunctional uterine bleeding. The question now, we have case study for women suffer from uterine bleeding. Which the following medication are going to use, progesterone or estrogen? So progesterone will be, or progestin will be the best treatment for the uterine bleeding. Okay. Progesterone, as you mentioned, this one, the progesterone, this is a natural progesterone. This is a natural hormones produced from mainly from the corpus luteum, and we have progestin. This is a synthetic hormones. Okay, so we use it for contraception and HRT, or combination alone, or combination with the estrogen. So we have progesterone, we have natural, we have synthetic. Progesterone is not used in the contraceptive because of the rapid metabolism and low bioavailability. So the natural, we don't use the natural because the rapid metabolism and low bioavailability. What we use in the practice, we use synthetic progesterone, synthetic progestins. Synthetic progestins here used because they said that progestin is more stable to the first pass metabolism and need lower doses. That means we have less adverse drug reaction or less side effect. So this will give us some information about progesterone and progestin. Progesterone is natural. We don't use it in the practice due to the rapid metabolism and low availability. We go with the progestin, synthetic progesterone, because it's more stable in first pass metabolism and allowing using lower dose with the effective results. Pharmacokinetic progesterone, as we mentioned, is like rapid absorbed, short half-life, primarily excreted in urine. We recommend to use with the synthetic progestins because it's considered like less rapidly metabolized. We have oral medroxyprogesterone, and oral medroxyprogesterone has a long half-life, 30 hours. For oral medroxyprogesterone, they developed injectable medroxyprogesterone. We have intramuscular, subcutaneous, and they found that if you prescribe this medication, intramuscular or subcutaneous, the half-life like 40 to 50 days. They said we can prescribe this medroxyprogesterone to provide contraception for 3 months. So we prefer to go with this medication, one injection every 3 months, to as a methods of contraception, compared with every day, one tablet every day for 3 months. So medroxyprogesterone injectable, intramuscular, subcutaneous provide contraception for approximately 3 months. We need to remember that in the practice. Any side effect, the patient may suffer from, if you treat the patient with the progesterone, patient may suffer from headache, depression, increased weight, change libido, normally decreased libido. Progestin has with the androgenic activity. We have two types. With progestin with the androgenic activity such as norethindrone, norgestrel may cause acne and hirsutism. Compared with the less androgenic progestin, we have norgestimate and we have drospirenone. This one may be preferred because this less maybe occur of acne and hirsutism. So we have two types of estrogen with the androgenic activity, norethindrone, norgestrel may cause acne and hirsutism, and we have some progestin with a less androgenic activity. We have norgestimate, drospirenone, considered like preferred treatment for women with acne. Last medication according to the adverse effect, we have drospirenone. Drospirenone, from the name drospirenone, this one remind us with the abiraterone, and this one considered like aldosterone antagonist. Aldosterone antagonist, the situation will be hyperkalemia, which means increased level of potassium, increased level of blood potassium, increased level of hyperkalemia, and what else we have, increased level of anti-mineral corticoids, and concurrent use with the ACE inhibitor may increase risk of hyperkalemia. Okay, the slide here show the diagram again. This concludes our topic about progesterone, progestin. Our next topic will be focusing on the medication that modify the estrogen and progesterone effect, and we are going to speak about SERM, selective estrogen modulators. Thank you for watching, and have a great day, everyone.